to Medical Monday. I'm here with Dr. Barry Jarnagin talking about female urology and pelvic floor pain. Lots of learning going on in the last hour. We have another caller on the line we want to get to. Sharon is calling in. Hi, Sharon.
Hi.
Hi, go ahead with your question.
Okay, could an underlying spine cause bladder incontinence? And also, are pelvic tilts good to help keep the bladder strong?
Can you ask that last question again?
Could pelvic tilts help to keep the bladder strong? You know, the exercise pelvic tilts.
Okay, what do you think, Dr. J?
So I think pelvic tilts can be helpful, and so that, you know, again, it's if you're doing them correctly, they can be helpful. Anything that you can do to build muscle, and the physical therapists I work with not only the pelvic floor muscles but also core. So there is value in that, and then back muscles and everything else. And so all those things are vital for overall pelvic floor health, if you will. As far as the spine goes, absolutely. The spine plays a pivotal role. If you think of the brain as kind of the central portion, and then the nerves run from the brain to the bladder through the spine is the 6-lane highway. And if there is a problem with that highway, it's like, you know, as I was driving here, you know, there was a car that had stalled or something had occurred and there was a backup behind it. And so the flow's not good. And so if you have a problem with your spine, it's going to cause problems with your bladder many times. And so it can either be where the bladder is, again, those spontaneous contractions we were talking about earlier, or it could be where the bladder just simply doesn't empty at all. Either way, there's a problem, and either way it can be corrected. Again, that pacemaker I was talking about addresses that and helps get that bladder and brain. It smooths out that communication that's been disrupted by whatever is going on in the back, whether it's spinal stenosis or just a spinal abnormality as she suggested, or a disc out, or whatever the case may be.
Yeah, so much goes back to our nervous system, and people forget about that our nerves control just about every body function.
And it's surprising the looks I get when I go, I think this is being caused by your spine. I get this look of, I can't believe that, because a lot of women, there's been a lot of women who think they, you know, if they leak, they have to have a sling, and they come in, they get their sling, and they go home. And unfortunately, that's not always the case. And again, you need an appropriate evaluation. You need to find out which one of those things are going on that we talked about as far as the types of incontinence, and then pick a treatment that actually will treat that type of incontinence. And so those are vital, and the spine plays a huge role in that.
Sharon, thank you very much. My husband's a chiropractor, and he's always preaching good spinal health from baby on up. You just, those nerves. So very important. You never know what they're controlling and what's going wrong. I wanted to ask you, and I asked you in the break, I said, can I ask this? We see these commercials on TV all the time about the bladder mesh, and, you know, if you've had this and it went wrong, call us and we'll sue. What's up with the mesh? Yeah,
so in prolapse surgery, if you use native tissue, in other words, if I just put tissue back where it belongs, the risk of recurrence is 35% across the board. And so that has been that's been kind of the known number. And so mesh came about because women, because hernia, everybody, and so they did studies, and the people who were getting mesh for their hernias actually did much better than those that had natural. And so then people go, well, if it fixes that weak tissue, maybe it'll help with the weak tissue in the vagina. So that's kind of how it all got started. It all got started by trying to reduce that recurrence rate. And so then we started using the mesh, and unfortunately the mesh that gets used in the abdominal wall doesn't work in the vagina, and it causes problems, and so it has to be a kind of a different weave, if you will, a different way it looks. And so mesh is not mesh, just like apples and peaches are both fruits, but they're very different. And so the discovery now is there's a different mesh that's more appropriate for one than the other. Now, with that said, there are risks to mesh, just like there are with the abdominal wall mesh. There are risks to the mesh as it gets put in the vagina. It's just that risk is not nearly as high or as big as the attorneys made it out to be. None of it was ever recalled. there were companies who chose to take it off the market because they didn't want to fight the lawsuits. And so it's a lot more complicated than people think. So in women who have had recurrent prolapses, mesh may be a good choice. Not necessary, but it might be, and something that you shouldn't fear. You just need to understand what the risks are. You need to make sure that if you do choose it, that somebody who does it all the time is doing it.
Sure.
Because it is a higher risk procedure. The biggest risk is that it can grow into the vagina. That's the biggest one. 3 to 5% of women can have that problem.
3 to 5%.
3 to 5.
Okay.
The other ones, the abnormal scars, the infections, growing into other organs, all those things are possible, but are really unusual and rare, as long as you have an experienced person putting it in for you.
Gotcha. So you want to check your doctor's credentials, what he or she is normally doing. This isn't something on the outside of their wheelhouse.
That's right. You want somebody who specializes in this and who does this frequently.
Okay. Let's hop to Joel. He's on the line. Hi, Joel. Thank you for calling in.
Hello.
Hi there. Go ahead with your question.
Okay, my wife is suffering from incontinence. The reason for this is that she's having to take medication to eliminate excess fluid from her body because she's suffering from congestive heart failure. So what I really want to know is, how can you know whether she's passing too much fluid or not enough?
Good question, Joel. Thank you for calling in.
It is a great question, and that's where the appropriate evaluation comes. There is some testing. We essentially hook the bladder and pelvic floor up to a computer, if you will, and run a test to see how the bladder is functioning. And then there is some homework we may give her where she needs to, we call it a hat. It's a collection device that she would pee into and measure when she goes and how much she goes, so that we can get a recording. And we start putting the results of the test with what she's doing at home over the course of 24 hours. We put those together and try to figure all that out. A lot of times it is related to the fluid medicine, but if she's incontinent, then there's probably something else going on as well, and things that we can do to make her better. Now, the fluid medicine is going to cause urgency. Because that's what it's designed to do.
Right.
And so, it's like anything else. If you have a weak part of your body and you're being pushed to use it,
you're loading up on it, right?
Then you're going to aggravate the condition. But there are things that we can do, and I would never sit here and tell Joe or anybody else I could make his wife completely dry. But certainly there's things that we can do to make her significantly better. She might get all the way dry, but at least get better. And there's a lot of women, and we didn't ask, and but a lot of women are going through 10, 12, 15, 20 pads a day.
Oh, wow.
And so if we can go from 20 to 5, we've made a big difference.
Yes.
And pads aren't cheap either.
No, they are not.
So not only is it a quality of life thing, but it's a expense side too. But if we get her all the way off of them, or we get her from maxi pads to a thin liner, then we've done something. And so, but there's a lot of things that we can do to make her better.
Okay. Very good. Joel, thank you for calling in and asking that. I wish you the best of luck. Again, when we come back, we are going to give you Dr. Jarnagin's information so that you can make an appointment, you can reach out and get some help. So get a pen and paper while we're in this commercial break, and we're coming right back with that information.
Thank you much.
Thank you.